Good afternoon, everyone, and thank you for the opportunity to present at the ILUTS conference today. Uh, my name is Chris Manakas, and I am a assistant professor at the University of Wisconsin School of Medicine and Public Health in the Department of Urology. And today I'd like to present our paper on the Jenna multi-cut solo and how it's more efficient than the Wolf Piranha. And we'll talk a little bit about why abortion later efficiency matters. I have no relevant disclosures. And so why is morcelator efficiency important? Well, it it takes a lot of time to morcellate. And anyone who performs HOLEP or any other anatomic enucleation of the prostate knows that morcellation takes quite a bit of time. And for every 30 minutes, complications in surgery increase by 14%. You can see in this table of aggregated studies that publish their enucleation rates and morcellation times separately. It is a significant portion of the procedure. And importantly, the morcellator is a device that frequently requires time-consuming troubleshooting. Troubleshooting is a distraction, and with that distraction, safety can become compromised. So with more morcellation becomes more troubleshooting, and that results in what I'd like to call the snowball effect. We have beach balls and morcellation that keep us up at night, but I would say this snowball does so more for me. You have a breakdown in the team that starts often with inefficient morcellation that progresses to suction not working. And now you have fluid canister changes that become more frequent. And then an inexperienced, potentially distracted staff. Next thing you know, the irrigation runs out and you have poor visibility, bladder decompression, and a bladder injury. This has become such a common occurrence for us to have morcellator troubleshooting problems. And in the moment, you can't always have a equipment representative at the bedside, nor can you have dedicated enucleation teams that are all experts in managing the morcellator. And this sort of an algorithm was really out of necessity to try to keep the patient safe and stay on task and really reduce the burden of work for the staff. But quite frankly, it shouldn't be necessary that we as surgeons are the subject matter experts per se of the morcellator. But in this case, it is essential part of being a successful HOLEP surgeon and HOLEP program that you are familiar with working this and troubleshooting this complicated device. But it's those frustrations and the desire to explore alternatives to our Piranha, which is the morcellator that we've used exclusively, that we had an opportunity to try the Jenna multi-cut solo last fall. Some background, though, about some of the differences in morcellation, or rather morcellators available in the United States. Up until last fall, we really only had the Piranha and the Cyberblade to compare. And Cyberblade is a single use. It is much slower than the Piranha, and we were eager to have this chance to try the multi-cut, but we don't have the drill cut jaws or the new Genius in the US like you do. And I'll also point out that the VersaCut no longer is sold or supported by Boston Scientific. So our study was presented at the AUA in Las Vegas earlier this year, is submitted for publication and in review. It was a design such that it was a retrospective review of a prospectively collected database. We are a high volume academic HOLEP center with performing over 600 cases per year. And two surgeons with a significant experience, all with Piranha, were included for the study. And importantly, neither of us had any prior experience with the multi-cut solo. 38 consecutive cases were performed using the multi-cut compared to the prior 100 consecutive cases with Piranha. These were both single-use blades, and the speeds were set for multi-cut based on manufacturer recommendations. Same for the Piranha. The Storz 28 French sheath is what we used during this study. I'd like to point out a few key differences between the morcellators, and you can see right away that the multi-cut device itself is different. You have a touch screen compared to the piranhas, which is what everybody thinks is a touchscreen until they try to use it, and then they struggle to find where the buttons actually are. So already the Multicut is a much more user-friendly device compared to the Piranha. You can easily adjust from the screen the suction rate, but we always kept ours at maximum. You can increase, decrease the speed, change the oscillation rate, and turn it on off. You also have a key difference in how it manages fluid. So with this suction mechanism being different, you have a peristaltic pump suction. There are no longer fluid canisters to change. And so this waste fluid simply dumps into a basin that can be changed at the end of the case. That compares to the Piranha with the vacuum canister and all of the associated tubing that frequently has to be examined and made sure that with each canister change, the tubing is not being crimped or twisted. And we found that the Multicut significantly reduces the burden of stress on the OR staff. The results, our patients and their pre-op characteristics were not significantly different, except for the IPSS quality of life score. But results of the comorbidities and other anti-coag status BPH medications, I'll highlight the fact that the 5-alpha reductase use, which has been hypothesized as affecting morcellinator efficiency, we found that there was no difference. Multicut solo versus Piranha efficiency was higher in the Multicut solo. We had 10.6 grams per minute versus the 6.8 grams per minute for the Piranha. Our prostate volumes were the same, path weight was the same, and importantly, no complications were experienced during the trial period. Now, there was a significant difference found, but there's some key things I want to point out. This was limited by its retrospective design, of course, lack of any discrete capture of troubleshooting issues. But even though we showed a significant advantage for the Multicut, it could have been faster. We had a blade manufacturing issue that was brought to our attention, and it wasn't really detected until about halfway through the trial. And what was happening was these pieces of tissue were being caught in the blade that was narrower than what they had hoped it would be, that led to time spent clearing those obstruction and frequently during the cases. Now, we didn't record individually when we had to clear that obstruction, but we did include that in the time. So all of that time spent, those were in the minutes spent. So our efficiency could have been significantly higher if we hadn't been using the defective blades. So we also included all of our cases. There is a slight technique adjustment in the early bits of the learning curve. There isn't as powerful a suction with the Multicut compared to the Piranha, and it takes a little bit of adjustment to grab the adenoma, bring it into the fossa, and once you appreciate that technique change, then you're off to the races. Also, we did include residents, and they're going to be, of course, a variable of efficiency compared to some of the expert surgeons. But taking that into account, we were staff. We were fast and we were safe. And you compare our numbers to some reported reviews that examined different morcellators and their performance. Piranha averaging about 5.3 grams per minute versus the drill cut and VersaCut, and then bladder injury rates reported below. This is an excellent review by Franz. Of course, I want to mention Dr. Schwartzman's excellent study. I understand he is presenting at the meeting this year, and I'm sorry I couldn't be there, and I hope someday we can meet and discuss the work. I admire your work from afar, and truly enjoyed your presentation last year comparing the different morcellators. And congratulations on an excellent study. This prospective randomized trial comparing the Multicut versus the Piranha. And I really liked your recording of the troubleshooting and your attempt to have something more meaningful than just time as a measure of morcellator performance. We've all been there when there were different versions of device failure and tissue density and the beach ball. And as we try to refine this device, this step of the procedure, I think this is an excellent model to follow as other studies might look to closely examine performance of these devices. Now, uh, you did show that, or rather, Dr. Schwartzman showed that the Piranha was faster than the Multicut, opposite to our results. But I want to point out that uh, you were following manufacturer spec to use the multi-cut blade in at least 10 times, and that's what it sounds like you did for the study, whereas the Piranha blades were fresh every time. Ours were using one-time use blades for both the multi-cut and the Piranha. So fresh blades versus reusable blades on the multi-cut. It's no surprise that the multi-cut was slower in your study, especially there was an excellent paper from 2017 that looked at how much faster Piranha was in the single use versus the reusable, especially at the 1500 RPMs. It was almost twice as fast using the single use blades. So in summary, the efficiency is one important measure of Morse later device performance, but it really doesn't completely reflect device setup or use, nor the troubleshooting burden on the staff or the surgeon. I want to congratulate the Jenna Multicut, the device designers. It is a major step forward in usability. And early studies such as ours and Dr. Schwartzman's demonstrate excellent efficiency and safety, but detailed reporting of device usability and troubleshooting will help reduce complexity of the case and hopefully lower barrier of adoption to enucleation. And on that note, I want to say thank you for this opportunity. Again, enjoy the meeting. I'm sorry I couldn't be there, and please don't hesitate to reach out to me.
So thank you very much.